Well, there may be a new glimmer of hope to treat COVID-19. It's an experimental drug that was created to treat HIV. Now the company is working around the clock, hoping to scientifically prove their drug will help. And Dr. Joe talked to the company's representatives and joins us now live. So what is the drug and how does it work, Joe?
Well, it's called Pro 140 or Leronlimab, and basically what happened was it was given to some of these patients that had COVID-19. We first heard about it about 5 years ago when Charlie Sheen announced that he had HIV. He was being treated with the experimental drug because that's what it was developed for. It's used, it's injected under the skin like insulin. It's a once-a-week drug, and the hope was that it was going to replace some of the pills that individuals have to take when they're trying to control their HIV, and it's still not approved yet, but hopefully will be approved soon for that purpose. But along with blocking the entry point of the HIV virus into the cells, the drug was also found to have some unique characteristics on the immune cells, and it's now in clinical trials to treat several different cancers as well. Dr. Bruce Patterson is CEO of NCellDx, and he has partnered with the company that makes Leronlimab. It was his idea to try to use the drug on COVID-19 patients.
It's really breaking this vicious cycle of this mass migration of immune cells into lungs. They release toxic chemicals. Those chemicals attract more immune cells that produce more toxic chemicals. I think the whole key has been to break that cycle and restore some normalcy to the immune response.
Now, Dr. Patterson says that the drug works by blocking some of those toxic chemicals, calming that inflammatory response in the lungs, and it also boosts other immune cells, making them more efficient in removing cells that have been infected with the virus.
Boy, that would be exciting. How soon will it be before we know it really works?
Well, they hope to know something in a few months. Now, the drug was first used in New York. It was used under compassionate use, so it was an investigational drug that the FDA said that could be used under this emergency basis. And then the FDA asked Cytidine, that's the makers of the drug, to launch clinical trials to study it scientifically. So that's what they have done. So far there are 2 studies. One study is for people that are severely ill or critically ill, and the second study is for mild to moderate cases, and they've already enrolled 15 people out of 75 in that study. And they hope to get that completed, that enrollment completed in the next 2 weeks. Now, according to the company, the drug was used in 5 patients, again, under that compassionate use. One of them was critically ill. All of them were taken off oxygen and discharged. Now, although no one can say for sure that it was Leronlimab that was the reason, Cytidine CEO Nader Pourhassan says stories like theirs are motivating him to work as quickly as possible to complete these studies.
Very excited, very tired, but very happy to be tired like this because this is great. When I hear from patients calling me and saying that you saved my mother's life or you saved my life, this is just amazing. There's nothing better than that.
Now, he says that they are getting requests daily from hospitals to join in those clinical trials, and that would mean that they would fill up even faster. He says about 70 now have contacted him. And even if a hospital is not participating, that investigational emergency use is still available. So if a doctor requests it for a patient that they believe that it may help, they can also get the drug that way.
Well, that's what everyone is hoping for, Dr. Joe. A good treatment that works, and then a vaccine. All right, thank you.